So some of the most important work that we do in primary care is prevention. It's one thing to be good at treating a disease, but it sure is better to never have to treat the disease at all. So in the last year with COVID, we have had people get behind on their preventative exams, like their once-a-year wellness visits. In the beginning of the pandemic, we actually asked people to stay away because we didn't yet know how we could take care of well people and sick people at the same time. But pretty soon on in the pandemic, we began to realize that we could treat sick people from their cars in the parking lot or in a side room and keep all the well people in the building masked and distanced the way we should. So now we know that it's safe to go to the doctor. We've known that for many, many months. It's safe to get your colonoscopy, your mammogram, your pap smear, your routine lab testing. We are doing this in a way that can keep the well people well, and we can still make room outside for those who are sick or symptomatic. There are definitely going to be some people, unfortunately, that 2, 3, 5, 10 years from now will have missed a cancer that could have been found during this last 12 to 16 months. In order to reduce that, we really need people to play catch up. So if you did not come into the doctor in the last year, or you're waiting for the right time, now is the right time. We are vaccinating people every day. Our staff is following all the precautions needed to keep you as safe as possible. And then those folks who are actually doing the screening tests, the colonoscopy clinics, the mammogram clinics, they are following all the right COVID guidelines as well. So if you will first find a primary care doctor that knows you and that you trust, let them start with the routine guidelines, the average way that we treat average folks, and then take that and personalize it to you. You may need sooner screenings, you may be able to push some screenings back, and it really just depends on what that provider can discuss with you and find out about your own personal history. But definitely this is the season for staying well, getting well, and deciding if we can finally get back to all of those topics that we had to handle before COVID came along.